Hi, my name is Garima Singh. I'm a child psychiatrist. I'm triple board certified, so I practice general psychiatry, addiction, and child psychiatry. I serve as chief medical officer and Burrell Medical Group and the parent company, Brightly Medical Group. I'm located in Columbia, Missouri, and live with my husband and two kids. I'm a cis female. I was born in India, so I'm Asian in ethnicity, follow Hinduism, and I am married and living in U.S. since 2008. I wanted to be a primary care physician or a pediatrician. And then while doing my rotation, I saw a kid who suffered significant trauma and was diagnosed with PTSD and was struggling. And the trauma she witnessed and was a victim, and what that resulted in the impact in our mental health and all the outcome of that, and the challenges of the treatment that kind of inspired me to do psychiatry, mostly child psychiatry, and just to learn more about the impact of mental health and its role in the physical and emotional health. So that patient and my rotation kind of changed my pathway and made me interested in psychiatry. So I'm involved both in APA and ACAP. I'm also, like as I said, both certified in APA, ACAP, and American Academy of Preventive Medicine, so addiction medicine. So I'm both certified and follow my membership in all of those. I sit in executive committee for Missouri APA, and I'm a member in Women Caucus for APA and for Asian American. So, just taking part and trying to be an advocate, what is the need of the community and how we can make a difference and increase awareness and reduce stigmas to mental health. I have a lot of interest in telehealth. So in last 2 years, with the result of pandemic, we have been working very hard to expand telepsychiatry platforms and increase access to mental health. I think as a child psychiatrist, you get to have a lot of fun with it. You get to learn something new every day. And, it's important to have an open outlook as we get to learn something new every day with the kids. As a physician and as a psychiatrist, we are providing them care, but we're also learning something from them and trying to be a better self to connect with those kids and provide them the care they need. There is definitely a pathway which is challenging as an international medical graduate. So, getting into the residency, learning into the new system. And as I said, I grew up in India, did my med school there. So we didn't have electronic medical records at that time. So coming and learning the new electronic medical record, learning the new system, getting all the US summaries exam, trying to connect to the people who have been through that journey and just navigating that pathway was challenging. But in the same pathway, I met some amazing people who were able to help me walk through that journey. And once you are into the system, it was not difficult. Then you have colleagues, you have friends, you have amazing teachers and mentors to hold your hands and show the way you want to go. And then slowly you develop your niche, what you're interested in, and you start exploring. So eventually things get better. But I think in the beginning, it's little intimidating to come to a country not knowing what is there and then exploring the pathway. And then, it's difficult mentally, and then you are leaving your family and coming as a young adult, just trying to um, unfold the puzzle and just find what is your interest and what suits you. And the whole nation, it's open. You are applying everywhere, looking for what's best fit for you. So in the beginning, it's intimidating, but once you step into it, then everything falls in place. So there has been people and, places and multiple pathways. I came to this country with, in the beginning, just exploring my way. I had my now husband, we both were navigating it together. So I had a very good personal support. But apart from that, some amazing friends. And during my journey, I met some really, really great mentors and teachers who were passively and actively are instrumental and integral in my professional career and the success I have achieved so far. For the most part, it has been really good. Like I have kids who and families who come with a very open mind. And sometimes, I tell them, I have an accent, let me know if you want me to repeat the questions. I won't be offended. Just let me know. And some of them are like, oh, we love your accent. Which country are you from? And, sometimes just taking that opportunity and educating them about the diversity, about, the different things. There are people who don't know where India is, and then just talking about different continents and things like that. So that gives us an opportunity of learning and increasing, knowledge. So that's been exciting. It's been really great learning from the kids. So I didn't do my education from US, and in general, I'm super curious. So I ask them all those questions, and they are so excited that they are teaching their doctor about their schools or what's going on. And so for the most part, it has been very positive, and then it has been a very good experience. So I went to med school straight after high school. That's what we usually do in India and some other countries. We don't go to college. So I think in general, when I look at my school years, I was always a very driven student and wanted to do things for other people. So I think some kind of health professional was the calling. And I ended up going to med school, and I am surely very thankful for that decision. So I have a dream, and I think that dream is the future of psychiatry. I have a dream that, I'm a child psychiatrist, so I'm going to talk about kids, that when our kids need us, they need us right then and there. And I don't think so in next 10 to 20 years, our kids are going to come to the office to see to see a psychiatrist, to see a mental health professional. They're probably going to sit in their car in a parking lot or in a dorm and, or in a classroom or in their home, and will have some kind of smart device and will be talking to us through the screen. It's not like that the in-person visits are going to go away, but I think, especially in the world of mental health, I think the technology is definitely going to enhance the care they provide. And I strongly believe that's where psychiatry and mental health is moving towards. It's it's a kind of care that when you need it right then and there. I have a dream our kids won't have to wait 4 to 6 hours to be seen in an ER or urgent care when they need us, or to have 3 to 4 months waiting period to see a physician or their counselor to get the care they need. So I always say that I have a dream of a day when my kids will see me right then and there. I just want to say it's a very exciting and rewarding speciality. You get to make a difference, and every mind is different. So it's challenging in its very unique way, but you make a difference in a kid's life. And it is very, it has a very positive impact and very rewarding.